Hey cousins, yes, you. If you test positive for HSV1 or HSV2, you are a cousin. If you're just a stiff mortar, you are a cousin. It is Herpes 101 Wednesday, and today we are going to be talking about herpes testing. Welcome to my channel. For those of you who don't know who I am Shana Singleton, also known as the Herpes Goddess, founder of Hey Cousins, growing the largest herpes awareness platform, and also the founder of the Slay the Stigma coaching program, where I help women stop their outbreaks and get laid. Yes, that is my magic. I've been researching this virus for the past 7 years now. I have been doing the field work, coaching and interviewing people within the community for the past 4 years now. I have the only advocate in the space that is known for creating more advocates and influencers in the space because I make people feel comfortable to do so. That is just my magic. I'm also a member of the National Coalition Sex Health and several books, all herpes related. Welcome to my channel. This is what I do for a living. I am the herpes expert. Now, let's really get into it, right? You all came here to learn more about herpes testing, knowing your status for just your own sexual health awareness, correct? Well, let's get into it. There are several types of tests available for herpes, and I am going to give you 5 of them. Are you ready? Go get your pen and paper. Test number 5. Polymerase chain reaction, also known as the PCR test. This test detects the genetic material, aka DNA, of the herpes virus in a sample from a sore or a blister. It's a highly accurate test and can identify it can identify which type of herpes you have, whether you have type 1 or type 2 present. Test number 2, viral culture test. This test involves taking a sample from the sore or blister and attempting to grow the herpes virus in a laboratory. It can determine the presence of the virus and also identify the type, HSV1 or HSV2. HSV, for those of you who don't know, is the acronym for herpes simplex virus. Test number 3, right? There's blood tests. Actually, 2 different blood tests. Maybe I should have split this down in 2, but I didn't. Blood tests look for the antibodies produced by the immune system in response to the herpes virus. You have 2 types of blood tests that are commonly used, the IgM and the IgG. The IgM antibodies are usually present during an active outbreak, while IgG antibodies develop later and can indicate a past or current infection. Blood tests can be different between HSV1 and HSV2. When you are looking at the results, you are looking for below 0.9 to test negative, and you're looking for above 1.9 to test positive. Everything in between is equivocal, so you may want to wait a few weeks to get tested again. Number 4, the Western blot test, right? It's a certain type of test that is a certain type of blood test used for diagnosing herpes infections. It's not commonly used and it's very expensive if you want to go get the Western blot test, but it's particularly used for confirming the presence of antibodies against the herpes virus. It is considered to be a highly accurate and reliable test, often used as a confirmatory test while initial herpes antibody tests, right? Test number 5, the ELISA enzyme link immunosorbent assay. Ooh, that's a lot. I'll put it in the video. It's a common type of blood test used for herpes testing. It is designed to detect the presence of antibodies produced by the immune system in response to the herpes virus. It's used for herpes simplex virus type 1 and herpes simplex virus type 2. A positive result on a herpes test means that the test has detected the presence of the herpes virus or the presence of herpes antibodies in the blood. It confirms that the individual has been exposed to the virus at some point. However, it is important to note that a positive result does not necessarily mean the person is experiencing symptoms or is currently contagious. It is recommended to discuss the test results with a healthcare provider who can provide appropriate guidance, counseling, and potential treatment options. That concludes this video talking about herpes testing. Hopefully that cleared some things up for you all. I just want to note that herpes isn't included in your average standard STD panel. It's something that you must ask for. Do not let your physician or provider tell you that they cannot test you with herpes without symptoms, because that simply is not true. There are tests that they can use to see if the virus is, if you've been exposed to the virus. So advocate for yourself, speak up for yourself, require these tests, and know your status, right? I think it's responsible for you to know your status versus waiting for symptoms to appear or playing the guessing game or being too afraid to get tested. Go get tested. Support is free. Your girl needs it. Like, share, subscribe. Again, I am Coach Shana Singleton, and I help women stop their outbreaks and get laid. That is my magic. If you're interested in my coaching program, go to www.coachshanasingleton.com. Again, make sure you subscribe to my channel. Every Monday, I'll drop a tip. Every Wednesday, I'll drop some facts, and every Friday we will be dismantling the stigma. Slay the Stigma Fridays. So you don't want to miss out on any of the upcoming videos. Make sure you subscribe to the channel. Thank you for being here. Have a good day.